Our memories make us who we are, don't they? They're the treasure chest holding our experiences, our love, our very identity. But what happens when that treasure chest is slowly emptied? When familiar faces become strangers, precious memories vanish like smoke, and perhaps most terrifyingly, when you no longer recognize yourself in the mirror. This isn't just a vague fear. It's the heartbreaking reality for millions of people worldwide and their families, caused by a disease called Alzheimer's, the silent thief of memory. Today, we're going to take a deeper look at this complex condition. What exactly is Alzheimer's? How does it attack our brains? And is there anything we can do to fight back? So, first things first, what exactly is Alzheimer's? Imagine our brain is made up of billions of nerve cells or neurons, all connected in a complex network that allows us to remember, think, and control our bodies. In Alzheimer's disease, these neurons gradually degenerate and die off. It's like the puzzle pieces of our memories are slowly falling away, lost over time. The consequence is that individuals progressively lose the ability to perform even simple tasks, struggle to understand speech, may not even recognize themselves, and can face profound loneliness towards the end of life. You might be wondering, who gets this disease? Alzheimer's generally comes in two main forms. The first is familial Alzheimer's, which accounts for only about 5% of cases. It's directly linked to specific inherited gene mutations and often strikes relatively early, sometimes before age 65. This is often called early onset Alzheimer's. However, the vast majority, around 95% of cases, are sporadic or late onset Alzheimer's. This form typically appears after age 65, and the risk increases significantly with age. For example, between 60 to 65, the prevalence is only about 1%, but over age 85, it can approach 50%, meaning nearly 2 people may be affected. Besides age, another genetic factor that increases the risk for this late onset form is carrying a specific gene variant called APOE epsilon 4. But why do these factors cause the disease? Current science points to two main culprits, two types of abnormal structures building up in the brain. The first involves the buildup of abnormal clumps called beta amyloid plaques. Normally, our brain has a precursor protein that helps neurons grow and repair. It gets trimmed by specific enzymes for recycling. But in Alzheimer's, this trimming process goes wrong, creating sticky fragments of beta amyloid protein that don't dissolve properly. They clump together between neurons, forming dense plaques. Think of these plaques like roadblocks or sticky gunk, disrupting communication between brain cells. This severely impairs signal transmission, leading to memory loss and other cognitive problems. What's more, these plaques trigger inflammation, further damaging nearby neurons. If they build up in blood vessel walls, they can also weaken them, increasing the risk of stroke or brain bleeds. The second culprit involves another protein called tau. Inside healthy neurons, there's a transport system like railway tracks called microtubules, which deliver nutrients and essential molecules. Tau protein acts like the ties that stabilize these tracks. It's believed that the amyloid buildup outside the cells triggers changes inside, causing tau protein to become abnormal and detach from the tracks. These tau proteins then tangle together inside the neurons, forming what we call neurofibrillary tangles. Without the stabilizing tau ties, the railway tracks collapse. The cell's transport system breaks down, nutrients can't get through, and the neuron eventually starves and dies. As both amyloid plaques and tau tangles spread through the brain, the symptoms of Alzheimer's become progressively worse. Initially, the signs can be subtle and easy to dismiss. Maybe forgetting recent events or conversations more often, misplacing things frequently. At this stage, the person might still seem perfectly fine to casual observers. But as more neurons die, short-term memory loss becomes more pronounced and persistent. Then, the ability to perform daily tasks starts to decline. Difficulties with dressing, preparing meals, managing finances, or navigating familiar places. Language abilities also suffer. Individuals may struggle to find the right words, follow conversations, or express themselves clearly, leading to communication breakdowns and frustration. Perhaps the most heartbreaking stage is when long-term memory begins to fade. They might forget the names of loved ones, cherished memories, or even significant parts of their own life story. Eventually, they may lose awareness of their surroundings, require full-time care for basic needs like eating and hygiene, become bedridden, and lose control of bodily functions. Sadly, death often results from complications related to immobility, such as pneumonia. Diagnosing Alzheimer's definitively while someone is alive remains challenging. A 100% certain diagnosis currently relies on examining brain tissue after death to confirm the presence of plaques and tangles. Doctors usually diagnose probable Alzheimer's by carefully ruling out other potential causes of memory loss, thoroughly assessing the person's symptoms and changes over time, and using supportive tools like cognitive tests or sometimes brain imaging. So, what can we do to prevent this devastating disease? You've likely heard plenty of advice. Follow a healthy diet like the Mediterranean diet, get regular exercise, don't smoke, limit alcohol consumption, keep your brain active with learning and social engagement. Honestly, all of this advice is excellent for your overall health and certainly beneficial for your brain. However, it's crucial to understand this. As of today, there is no single scientifically proven method guaranteed to prevent Alzheimer's disease. While these healthy lifestyle choices may help reduce the overall risk or delay onset, they are not a guarantee. Much research is still ongoing in this area. And here's another sobering reality. Alzheimer's currently has no cure. Existing medications may help manage some symptoms, like cognitive decline or behavioral issues, for a limited time in some people. But they do not slow or stop the underlying disease progression. They cannot reverse the damage or bring back the lost brain cells. Therefore, when facing Alzheimer's, the most crucial element becomes care. As patients gradually lose their independence and cognitive abilities, compassionate, patient, and informed support from family, caregivers, and the community is absolutely essential for maintaining their quality of life and dignity. Patience, understanding, respect, and love are invaluable. They help the person feel safe, connected, and valued, even as their memories fade. Hopefully, this explanation has given you a clearer understanding of Alzheimer's disease. Please pay attention to your brain health and that of your loved ones. Be proactive in learning, recognizing potential early signs, and don't hesitate to seek medical advice and support when needed. Early awareness and understanding can make a significant difference